Whenever you go for a doctor's appointment, chances are you'll have to fill out a form on your family's medical history. But for many of us, gathering this kind of information is not too easy. So why do we need to know our medical history? How is it used? And what happens if we just don't know it? Joining us with more is family practitioner and author of the blog Yes5.net, Dr. Karen Latimer. Dr. Latimer, great to see you.
Nice to see you, Tanya.
So family history. Now, right there, we're including our family. Already can get complicated. Anything involving the family.
Oh, true.
How important is knowing your family's medical history?
It's quite important. It's part of a piece of the history of the whole patient, and it helps us assess the risk for certain diseases, for certain conditions. And if there is a pattern in a family, then that may alter what we do for a patient in terms of recommendations, and especially recommendations for screening tests. Most notably would be colon cancer or breast cancer. If there's a strong family history, often we'll recommend that a patient get screened earlier than the general population and possibly more frequently, or even with different types of tests.
Right.
So it's great for that. Genetic diseases, if you're family planning or pregnant, you want to know if there are any genetic diseases that run in your family, and you can speak to your OB about those things.
So there are specific diseases or specific cancers, let's say, that it is helpful to know the family history about. But again, there are certain things which have no genetic background. So knowing your family's history is no guarantee that you're going to be safe.
That's
correct?
absolutely right. It's not at all a way we can't predict the future. All it does, again, is help us assess risk.
Right.
And just as if you're a smoker or a drinker or are obese or have an unhealthy diet, that's also risk for certain things like cancers and heart disease.
Right.
So it's just part of the puzzle.
Right.
It's an important piece of the puzzle,
Sure.
but it's just part of what makes up a person's risk for
and
certain
that is
things.
specifically how doctors will use your family's medical
That's
history.
right.
Right. Okay. So let's say you need to collect this information from your family members, and you're lucky enough that most of your family members are still living,
Right.
and both sides of the family are around, because
Right.
all of this is a rarity for a lot of people.
That's right.
How do you then go about collecting this information?
Well, I think it's good to find the busybody in your family. Find the person either on your mother's side or your father's side, both. You get 50% of your DNA from both, who will know the most. And everyone has maybe that aunt. I usually find it's a woman is better. But you want to really be very clear about what you're doing and why you're doing it. Share your purpose with them so that they are more open with it, and also tell them that you want to share this with the rest of the family, because if one person does it, actually is very helpful for everybody.
Yes. And
you want to be sensitive, and you want to respect privacy, and it also often is very difficult for people to talk about these things, so you want to be a good listener and prepare yourself. Come with a pen and paper and
Right.
write down anything they say. It might pop up that doesn't seem important at the time, but it might start to be put together.
And is there a list of specific questions you would recommend? Because it's one thing, even if you find this aunt, this busybody who knows when everyone died, she may not know exactly what they had, or, I mean, so should you specifically ask, Aunt Sally, did anyone in our family have breast cancer? Did anyone have, a heart attack? Or should you just ask them general questions?
Since you have the time with the patient, and make some time for it, and sometimes it's better even to do it as a questionnaire and to hand it to somebody or help them fill it out, or do it not face-to-face, just in writing. Give them that opportunity. Sometimes people are more open.
Yeah.
But what you want to do really is look at 3 generations. And I would go through person by person. I would take the time to do this. This is not something you have time to do in your doctor's office, but certainly something you might have time to do over a cup of coffee. And you want to say, what did grandma die of? What, grandpa? And not only what did they die of, what age were they when they died of it? And what other conditions did they have going in? Because they may have ultimately died of breast cancer, but they may have had very serious heart disease. So you want to get the whole picture. And it's, again, not always easy, but you want to look at aunts, uncles, grandparents, siblings, cousins.
Right. And what is the information that we should include? I mean, sex, male or female?
Sex, male, female, age of diagnosis, age of death. Any mental health, which is extremely important. A lot of mental health conditions do run in families, do have genetic predispositions, and especially depression, schizophrenia, dependency issues like alcoholism runs in families. And these are the things that people don't want to talk about, but especially I find almost more for my children, these are the things that I want to know.
Sure.
Maybe I'm past that point, but they may not be, and you want to know if your children are at risk. So
but you're right, these are
pregnancy issues.
Those are some of the questions, though, that people don't like to talk about, and especially when it's in a family, they kind of want to keep them hidden,
That's
alcoholism or depression. So
People
how do
are
you sort of
ashamed.
carefully get that information out?
And I think, again, the way to do it is really just to let them know why you're doing it. You're not doing it because you're being nosy or you just want to be gossipy or you want to be able to tell somebody else about it. You're doing it because you want to protect your children. Family history really helps us you know, early detection, early
Right.
diagnosis, maybe not preventing a disease necessarily, but the earlier you can detect something, the better, including mental health and dependency issues.
And you do have some words of comfort, though, for so many of us out there who maybe we have no idea one side of our family where they come from. There are so many families these days that have, you know, used reproductive assistance of some kind or another. So people shouldn't worry if they don't have the full picture.
No, if you're adopted, even you have an adopted child,
Right.
again, this really is just part of the whole picture.
Yeah.
I do think it would be important to talk to your doctor about the fact that you don't know.
Yes.
Because
Let
that
them
may
know.
also change things.
Yes,
That may
yes.
you may see that you want to go for a cardiac screening earlier because you don't know your family history.
Sure.
And maybe not, but it's all a very individual thing, but it's not the be all and the end all. So don't be lulled into a sense of confidence because you have no family, you know, no strong family history of any
Right.
terrible diseases, and don't be terrified because you do. And don't worry if you don't have any history at all.
Right.
It's a great thing to have. It's part of the puzzle. It doesn't tell us the whole story, though.
Just a piece.
Just
All
a
right.
piece, absolutely.
Thank you so much, Dr. Karen Latimer.
Welcome.